The following portion of Indy Now is sponsored by HearBest, and for years, hearing aid has developed from bulky instruments into nearly invisible devices.
Dr. Judy Olson from HearBest is joining us today to share what's possible now that hearing technology has really evolved and why HearBest is proud to be the first provider across the Midwest to offer this next generation of technology. Dr. Judy, it's good to see you as always.
Dr. Judy.
Thank you. It's great to be back.
Yeah,
Great to have you here. This is a topic that is so important, I know, and you've been fitting hearing aids for more than 2 decades now. So you have seen these devices evolve over the years. What are we looking at here in terms of like frustrations that patients have had with the technology?
So over the course of many years, you know, hearing aids used to be really big and bulky. In fact, the first hearing aids were actually a box that you would wear on the body that then would have cords going up. Yeah.
Interesting.
Wow.
And then they evolved to being at the ear level, and now we have come many generations of the miniaturization of the technology, and which brings us into the digital world that we live in now.
It's incredible to see these advancements, and I love that you're an expert on. What are we seeing on our screen right here? What is that?
So these are the brand new Oticon Zeal devices.
Okay.
They are very, very tiny. They fit in the ear, and they're basically invisible in the ear.
Wow. And are those customized to each person's ear, or how does it work?
Yes, so there's a couple ways that we customize these devices. So one way is in the actual fit itself. So we put a little kind of rubber dome on the end to help fit the device properly, and there's many to choose from based on the degree of loss and the anatomy of the patient's ear.
Okay.
And then the other way is the expert programming that we use. We use a very specific fitting protocol called the HearBest optimization method. That, paired with the amazing technology in this very tiny device, really provides the absolute best results for our patients.
That's awesome. They're so discreet too. I think that's what a lot of people are looking for too, because sometimes people, you know, they're realizing, gosh, my day-to-day life is being affected by the hearing loss, but I don't really want people to know that I'm doing it for whatever reason. So those are really tiny. Yeah,
and I'm sure more comfortable, definitely. When you are talking to your patients, what are they noticing most when they're upgrading from maybe some of the older hearing aids to today's technology?
One of the biggest upgrades in the technology is how the devices handle background noise. So years ago, the devices just kind of amplified everything. And so it's no wonder that people that were having trouble hearing had even more difficulty in background noise. So now the devices are so sophisticated, they're sampling the environment 500 times per second to automatically adapt, and they create a very large separation between speech and noise. The devices are now able to determine what is noise, what is speech, and analyze all of that and instantaneously deliver it to the patient's ear.
That's incredible.
Oh, that is incredible.
Now, to fix hearing loss, you first have to know that you have it. So if someone's seeing this right now and they're wondering, oh my gosh, that's either me or maybe it's my loved one, what are some of those steps in the process? What does that entail to go in and get checked?
So anybody over the age of 40 should start having an annual routine hearing screening, just like everything else on the list. Eyes, teeth, all of those things, right? Because hearing loss can come on very gradually over a period of many years. A lot of times we don't even know that we are missing anything until it's kind of gone on for a long time.
Okay, so get out in front of it. Yeah,
Exactly.
get those regular checkups.
Well, like you said, when it's subtle like that, it's hard to notice the difference day to day. And then someone might come in and say, oh, wow, I had no idea.
Right. And so a lot of times, you know, people think that hearing is an ear problem, but actually it's a brain issue. So the longer the hearing loss goes on and gets worse, it actually impacts our brain function.
Gosh, yeah, you want to take care of it. There's locations all over central and northern Indiana that you all have. What's the best way to get in touch with you all?
The best way to get in touch is just to go to our website, and you can schedule an appointment right there or give us a call.
Yeah, give them a follow on social as well. And Dr. Judy Olson has also written the book Clear Connections that you can learn more about. Thank you as always. We love it when an expert like you is on the show to teach us and our viewers just about how we can live our best lives.
Exactly.
So thank you.
I know we always learn something new, so thank you very much.
Thank you.
Thanks, Dr. Judy. The preceding portion of Indy Now was sponsored by HearBest.